Bring on an expert now. This is Dr. Anahita Dua. She is the chair of Healthcare for Action, and she's concerned about this latest measles case, Celeste. So let's do that right now. Doctor, good morning. Thanks for joining us.
Good morning. Thank you so much for having me.
What is your greatest concern about this latest case? And I guess by virtue of the fact that it was at the airport, that kind of raises the number of people who might have been exposed, yes?
That's exactly true. But you know what's the most concerning thing is actually there's been a number of news articles from Arizona where they've actually described all the places that measles has been quote unquote spotted. And it's, Chick-fil-A and a yogurt store and a baseball game. It's kind of everywhere because that's how it works. And so, of course, the airport's a huge deal because if someone's breathing and you were to walk right next to them and you're not vaccinated, the chances of you catching measles is really high. But you can think of an ice cream store or a kid's baseball game. There are going to be children there too. So that's, I think, the most concerning thing about it, how quickly it's all over the place.
So let's say hypothetically you were at one of those locations, Dr. Dua, or you happen to be at Sky Harbor Airport on that particular day. What should you be aware of and look out for? And I know a lot of people are already vaccinated for measles, but what should we be aware of?
Great question. So first of all, let's talk about that vaccination thing, because if you are vaccinated against measles, then your chances of anything happening to you are incredibly low. And that's because the way that the vaccine works is you develop kind of response. You've trained your body to be able to handle it. So if you get exposed again, your body's ready to go. If you aren't vaccinated or you're immunocompromised or maybe a kid that's not vaccinated, then the issue is that 9 out of 10 people who are not vaccinated who get exposed to it will actually get the disease. So if you were in that particular situation, the biggest thing to do is to watch yourself for symptoms. If you have a rash that's unexplained, if you have a very high temperature, if your eyes change color, like really red and runny, then you do need to contact a public health official and then kind of go from there.
So what if you had a vaccine when you were a kid and now you're 40 years old or 50 years old? Are you still protected?
You are. That's the beauty of the vaccine. Normally you get 2 of them when you're a child, and they're a little bit apart from each other, a couple of months apart from each other. And with that, you can have protection of up to 97%. There's nothing that's 100%, of course, but even if you were to contract it, of course, the level of attack that your body would get would be lower than if you weren't vaccinated. It's just a lot of words to say that, even RFK has come out very clearly and said, for this one thing, for measles, the vaccine is the way to go.
There's a question in the chat from Thomas Favela. He says, why not keep infected in isolation? Is the issue that sometimes people, let's just say hypothetically, this recent case at Sky Harbor Airport, they're walking through the airport and they really don't know that they've been infected until it's later, until they're home. And then, so maybe that could be the case?
That's almost 100%. I mean, I hope that human beings are better than that they knew they had measles and they walked around an airport, but I guess, these days, who knows? But I will say that the likelihood that someone potentially was exposed or infected and then they maybe didn't know they had it for a little bit is possible, because if you are exposed to measles and you actually were to get it, it can stay in your body before it shows symptoms for up to 21 days, so almost a month. So it's completely possible that somebody got the exposure, got the disease, but then didn't realize it and technically would have been able to spread it for the last 21 days. And then they contact public health, and then public health says, oh, crap, you were at the airport at this time.
Yeah.
We got to take care of business.
All right. If people want to connect with you, would tell us about Healthcare for Action, what you guys do, and how they can reach out.
Absolutely. So Healthcare for Action is an organization that's really run by healthcare workers, where we try to reach out and educate people about the best candidates for them in the healthcare space. We actually are doing quite a bit of work in Arizona with a couple of the primaries that are going on there, because there are a couple of doctors that are, and a nurse actually, that are excellent candidates. And we sort of talk about how they fit into the political landscape. So if you want to check us out, just jump online and check our website out. And I'm, of course, always happy to talk to anyone who's interested.
Dr. Dua, you've been amazing.
Okay, I'm going to quit referring to my Rolodex because everybody mocks me. But we're keeping you.
On our favorites list. On our favorites list.
For sure.
By the way, are you a fan of Dua Lipa? Dr.
Of
Dua.
course.
There you go.
I'm the hotter version, of course, but that's okay.
I love it. Okay, talk to you again soon.
Have a great weekend.
Hey,
Thank you.
Celeste,
Bye-bye.